Vericella-Zoster Virus, or VZV, is a common human herpes virus. Most people know it for causing chickenpox. After chickenpox, VZV lies dormant in the nervous system. Later, it can reactivate as shingles, causing a painful rash. VZV spreads through direct contact or the air. Shingles blisters are also contagious. Shingles is more common in older adults and those with weakened immune systems. Understanding VZV helps us manage its impact through vaccination and early treatment. After the initial chickenpox infection, VZV takes a strategic retreat. It travels from the skin along nerve pathways. The virus settles down in the nerve cells called ganglia. These ganglia are located near the spinal cord. This is where VZV establishes latency. During latency, the virus remains inactive. It's like a bear hibernating in a cave for the winter. The virus is not replicating. It's not causing any symptoms. The infected person is unaware of the silent guest within their nerve cells. However, VZV's silence can be deceptive. The virus is not gone. It's simply biding its time, waiting for an opportunity to re-emerge. Various factors can trigger VZV reactivation. These include age, stress, and a weakened immune system. When these triggers occur, the virus can awaken from its slumber, leading to shingles. The reactivation of VZV is often a consequence of a decline in immune function. This is common as we age. Certain medical conditions and treatments can also weaken the immune system. These include HIV infection, cancer chemotherapy, and organ transplantation. When the immune system weakens, VZV sees its chance to strike. The reactivated virus travels back down the nerve fibers. It reaches the skin, causing the characteristic shingles rash. This rash usually appears on one side of the body, often the torso. It presents as a band of painful blisters. These blisters can be itchy and sensitive to touch. The reactivation of VZV is not always predictable. However, recognizing the potential triggers and understanding the symptoms of shingles is crucial. Early diagnosis and treatment can help manage the symptoms and reduce the risk of complications. Section 4. Beyond the rash. Complications of shingles reactivation. While the painful rash is a hallmark of shingles, the complications of VZV reactivation can extend far beyond the skin. One of the most common and debilitating complications is postherpetic neuralgia, or PHN. This is a persistent nerve pain that can last for months or even years after the rash has healed. VZV reactivation can also lead to other neurological complications. These include encephalitis, meningitis, and myelitis. These conditions involve inflammation of the brain, spinal cord, and surrounding tissues. VZV can also affect the eyes, causing vision problems. In addition to neurological complications, VZV reactivation has been linked to an increased risk of stroke and other vascular events. This is because the virus can cause inflammation and damage to blood vessels. This highlights the importance of early diagnosis and treatment of shingles to minimize the risk of these potentially serious complications. Section 5. The unseen enemy, VZV reactivation without a rash. While the classic shingles rash is a telltale sign of VZV reactivation, not everyone experiences this symptom. VZV can reactivate without causing a rash, known as zoster herpeti. Individuals may experience pain, itching, or tingling where the rash would typically appear. Virologic testing is crucial to confirm the diagnosis. Early diagnosis ensures prompt antiviral treatment to manage symptoms and reduce complications. Section 6. Fighting back, antiviral treatment and vaccination. Antiviral medications play a crucial role in managing VZV reactivation. These medications inhibit viral replication, reducing symptoms. They are most effective within 72 hours of rash onset. Vaccination is another important tool against VZV. The chickenpox vaccine reduces the risk of shingles later in life. For older adults, the shingles vaccine is highly effective. Antiviral medications manage symptoms, but vaccination is our best defense.